recording. Are there any like faculty that are here? Just wanted to wave really quickly, say hello. I know I see Dr. Lee. We can get you all at the end. There's so many people here. So basically oh, there you are, Dr. Lee. Hey.
Hi, my name is Chi Lee, and I'm one of the faculty in the CEPR department. First of all, thank you so much for taking the time or making the time to join us today. Like Tristan mentioned, usually we will have this in person, and we'd love to see you guys in person as well. Again, thank you so much for your understanding and time. And today we will leave the time to you guys. And if you guys have any questions, I guess I'm the faculty representative today. So I'm happy to answer any question you guys have.
And I see Dr. Schaus is here too. Do you want to wave? Hey, Dr. Schaus.
Hi, everyone.
We're so glad you can make it.
Thanks for having me. I appreciate it.
All right. So just how this is going to go, because we have so many sites, we're going to do like 5 minutes each, and we're going to save questions towards the end just to give everyone enough time. And I am actually, the first one on the list is the Transformation Center, where they had something come up at the last minute. And so I will give the brief overview of transformation since I was there before. It probably won't be as in-depth as Kimberly, the supervisor, would give. And I have her phone number. And so if anyone has questions about the Transformation Center specifically, I will put my email in the chat box and just send me an email, and I'll be happy to connect you with Kimberly, the supervisor for transformations. And so basically the Transformation Center they are a partial hospitalization and IOP program for adults. They work with a lot of trauma, and they also specialize in eating disorders. And so people, like if you were there, you would be running a lot of groups and seeing clients individually. They have Kimberly is the new supervisor there, but she would be the best person to ask questions about the site because they've been going through a lot of changes. And I will just move it on over to Maya J. She's at the site now. Awesome. And I will just pass it along to Hope House.
Hi, I'm Natalie Pritchard.
I'm Elise Haynes.
We are not the supervisors at this site, but we are two former U of M counseling grads who work here now. And so Melissa Farrar is the supervisor, and she's doing a training, so she couldn't be here today. So figured we would give you the spiel on Hope House. So I am the Aging Outreach Services Coordinator, which means that I work with population 50 and older. I also I'm under a grant doing surveys for feedback and trying to improve what we do and how we do it.
And I am a child and family therapist here under a new grant that we have working with adults, children and families. Here at Hope House, we have adult services, a daycare, and a preschool. And we serve the HIV infected poverty here in Memphis. And we have a little brief video that kind of gives you an overview of our services that Natalie's going to try to key up.
Yes. Am I allowed to share my screen, Tristan?
I think so. I might have to.
Because I need permission.
Yeah. Because I could make you the host, but I don't know if that would stop recording.
If it's too much, we can just explain it. It's too much.
I just don't have like the upgraded Zoom.
Oh, okay. So we'll just explain it. Essentially, Elise just kind of shared this, but we have I'll mainly talk about the adult services that we offer in our social services, and then she can talk about the family and the daycare, preschool, all of that. So essentially we are a nonprofit, which means that we do a lot of different things and we're very team oriented. And so the one role that you have here is not your one role. It's kind of like all hands on deck, everybody in. And so to make the clients our priority. So we have a food pantry. We're a Mid-South food bank partner. And so we get our food from them and also from private donations. So we have hygiene and cleaning from donations as well. We do group therapy and individual therapy. We do medication adherence. We have rental assistance, utility assistance, housing. A lot. Yeah, I think that covers it. And so we're mainly operated under grants. And so we're able to pretty much do whatever we get a grant for, whatever we can find funding for that our clients need. So essentially it's meeting them where they are. And we work with, like Elise said, people living in poverty, people affected by and living with HIV and or AIDS, also people in the LGBTQ plus community, people in the elderly community. So we do a lot of outreach as well. And so we have a big staff with a lot of different things that they do. So yeah, that's pretty much our social services.
And then for our daycare and preschool, as an intern, one of the things that you would likely get to experience is to participate in play therapy. And so we have a room here in the preschool that is a play therapy room. You would also have opportunities to interact with the children in the daycare, in the classroom, or even on the playground, and sometimes to do some therapy there as well. And then for, the families or parents that of our preschool children or daycare also assist with individual or group counseling, just kind of depends. We also provide for our daycare and preschool families the same food pantry, any utilities, rental assistance. We also provide diapers, formula, anything that just to supplement any needs that they might have. So you get exposure to all kinds of services and a great deal of experience.
Awesome. Thank you so much for sharing. Up next, we have the transition house.
Hi, my name's Catherine. I am one of the therapists at the transition house. Our clinical director went into labor today, so bear with me. So we provide outpatient services to a pretty broad clientele, which is one of the things I really enjoy about it. So we have contracts through the FBOP, so the Federal Bureau of Prisons, as well as with federal probation. So with that, we see some mental health referrals, substance abuse referrals, sex offender referrals, and some that are all three. We also see private insurance clients and Medicaid clients as well. So it's really, a little bit of everything. We actually, a few of our interns and prac students are on here right now. And if you guys know them, I'm sure that they would be more than happy to tell you guys about their experiences. But pretty much our students do the same things that we do. We facilitate individual sessions. We also have groups. Right now, the only ones that we still have going are substance abuse. And we're doing those right now. Everything is still virtual. So we're able to do those on Zoom, and it's actually been pretty beneficial, and our compliance rates have actually gone up a little bit because clients can be at work and stuff like that and not have to leave and go to the office. I saw that one of the questions that you guys asked was about confidentiality while we're doing telehealth, which was a really good question and definitely something that's been a lot of trial and error in terms of clients trying to do all sorts of crazy things like walk through Home Depot with the whole group seeing them. We just make sure that everyone has their headphones on, ask that they be in a private place, so no one else can see who's in the group and stuff like that. So with our FBOP clients, they're either currently in the halfway house or they're on home confinement and have an ankle monitor on. And with probation, it depends on who, but it's generally, less restrictive. And then, it's private or with any type of insurance clients, we see a broader, variety of presenting issues. So yeah, I think that's pretty much it. We're both a for-profit and a nonprofit. And yeah, if you guys have any questions at the end, I'd be more than happy to answer them. I think that's the general spiel though. Thank you.
Thank you, Catherine. And if anyone has something else going forward, if they want me to share for them, please you can email that to me. If you don't have anything, you don't worry, you weren't prepared. You didn't have to prepare anything, but I will go ahead and put my email address in there. If you do want me to share anything, just let me know. All right. Next, we have Baptist Health Science University.
Hi, my name is Karin Schmitz. I'm the counselor here at Baptist University. We had a name change last August. It was Baptist College of Health Sciences. We're located real close in the medical district. I'm the one and only counselor here. We have about roughly 900 students right now. It's kind of fluctuated a little bit with the pandemic. Currently, all of our classes are virtual. However, so Baptist College is or university, unique. It's specialized for nursing and allied health. So everybody coming here is focused on a career in the healthcare field. So those that are in their clinical right now are meeting some in labs, but other than that, everything else is virtual. Which has been interesting as far as the counseling goes and getting that set up. I'm not allowed to have a practicum student at this time. I'm hoping it'll change in the fall. And the other thing I wanted to say is I probably don't have enough work for a full-time internship. It could possibly be maybe working out for a part-time, just depending on kind of where we are in the world and how things are going, if we're back on campus or not. At this time, I'm able to work with students in person if they'd like to come to campus. So I'm enjoying that. I have several that just can't wait to get out of the house, socially distanced and all that. Our average age student is about 27, 28. So we don't have as many freshmen or traditional age students. Probably say about 10% of our enrollment are actually true freshmen. A lot of them are coming back to change a career or transferring from other locations. We have a pretty diverse population as far as probably pretty close to almost 50-50 between students of color and white students. And so I think that's wonderful. We do have more females than males though. We're very female heavy. And once we're on campus, we have about 150 or so that live in our residence halls, and the rest pretty much commute. So it's kind of a unique place. And as far as I've had a practicum student before in the past, and she, they can have a small course load, do the supervision. If you want to start a group or try that, I'm supportive of that. Any activities or preventative programs that you want to put on. I'm real big with suicide prevention and awareness. I'm also the advisor for Active Minds here on campus, so a student could help with that. So I think there's plenty of work to get the practicum hours, but for the intern hours, it might be a little bit harder for those. Trying to think if I missed anything. We're typically open, Monday through Friday, kind of regular office hours, but the schedule can be flexible because some people need to come in the evenings, and we do have, or hopefully, again, we'll have people living on campus. So I work with the student services team, so and help them as well. But I'd love to talk to anybody if you're interested in working on college counseling center. It just looks a little different than probably like U of M or Rhodes or some of the bigger schools. So thanks.
Thank you so much for sharing. Okay, moving right along, we have Daybreak Treatment Center next. Trying to see if Madison is here. Okay. Thanks, Karen. Okay, Madison, I know she's coming, so maybe she's running behind. Kindred Place, I know I saw y'all earlier. If you want to hop on, all right, awesome.
Hi, good afternoon. I'm Jennifer Weaver. I'm with Kindred Place. Many of you all may know Kindred Place from a long time ago as Exchange Club of Memphis. That's what we're formerly known as, but we are Kindred Place. We are in Midtown Memphis. We're right next door to Playhouse on the Square. We have new signage up, so hopefully if you're in Midtown Memphis, you'll take a look at our new signage. We're really proud of that. And so our motto is peace begins here. And so we are a counseling and education center for adults and children, but we really specialize in family dynamics. So really we see everybody at Kindred Place. And so we have 13 clinicians on staff. We have a bilingual clinical staff. So if that's something that's of interest to you, if you, want to look at working with a counselor who has bilingual clients, we have that. We're a child abuse prevention agency. A lot of you all may know us as an organization that works with domestic violence survivors. And so we have a victim services clinical piece as well. Historically, we have had group sessions. This last year's been really challenging for that at Kindred Place. We've had a little bit of success, and then we've just had to discontinue for the moment some of our group services. But historically, we've had adult anger management groups. We've had a women's survivor group, a children's survivor group. We have educational classes, couples to co-parent. We have parenting classes. We have a group called Active, which is Achieving Change. It's a 24-week course for those who go through our domestic violence assessment center. I'll talk about that in a moment. And if they're recommended to that group, it's a 24-week group that really focuses on changing behaviors. But we also have our Domestic Violence Assessment Center, also known as DVAC, and it's a clinical psychological assessment and treatment recommendation for adults who have a history of intimate partner violence. And I know a lot of interns have historically worked through the DVAC Assessment Center. So if you have colleagues that have worked at Kindred Place, they probably have gone through that particular program. We also are really excited that moving forward, all of our clinicians are trained in feedback-informed treatment. FIT, that's a modality that Scott Miller has introduced. And so it uses measures to solicit feedback about progress and the quality of the therapeutic relationship. It's a trans-theoretical evidence-based approach. And the most recent research shows clients whose therapists use feedback-informed treatment on an ongoing basis are 2.5 times more likely to experience benefit from treatment. So we're really excited. We start that day one with our clients. So it's an interactive, just treatment approach that we have. If you guys are interested in feedback-informed treatment, I encourage you to, as cliche as it is, Google it. But if you have questions around that, you can always email me. I'll put my email in the chat as well. It's been super, it's kind of cheesy, but it's been super great to see how excited our clinicians are about feedback-informed treatment and how transformative it has been with our clients. And I really believe that's a testament to the interactive nature of feedback-informed treatment. Trying to think here. I'm the Director of Organizational Development at Kindred Place. So currently I do help with the training and onboarding of interns. Some unfortunate news that we had to make a decision last Thursday that we're not taking master's level interns or practicum students this summer or fall. There's just been there are a lot of variables for that, and we are very saddened to share that news because we value our relationships with the University of Memphis students, and we know how hard it's been to get placement, and we feel that struggle for you all. There's just a lot of factors in place, not only with COVID concerns, the lack of group programming that we're able to provide. We just want to make sure that you all as students have enough hours and get the best supervision that you can. And so we just we've been struggling with that decision, but it finally got made last Thursday. The exception to that is, and I'm not quite sure, Tristan, if there are doctoral students on this call, but we may be able to take 1 or 2 doctoral internship students, but I've talked to Dr. Cogdell about that. But please keep us in mind. We are very hopeful that in January 2022, that just seems so far away, but 21 seemed a long time away too. Please keep us in mind. And if you have questions about Kindred Place, I'll put my email. If you have questions about feedback informed treatment, you can also email me or Google. But we feel very grateful to continue to try to be a safe landing spot for students at the University of Memphis. So Tristan, I'm gonna turn it back to you.
Thank you, Jennifer. And yes, I interned at Kindred Place in my undergrad and master's, so I can say that it's a great place to intern. And so I know sometimes students will come early to the fair to learn about sites. So hopefully there are some that are just starting the program that they can maybe go to Kindred Place later on. So thank you. Alrighty, so we have, I don't see Madison yet. Okay, we have Church Health Center. Oh, wait, there's Madison. Hey, Madison.
I'm here.
Oh, you're a Daybreak. Okay, I was looking like alphabetically. I didn't see. Okay, cool. Sounds good.
Are you ready? Ready
Yes.
for me?
Ready.
All right. So I'm Madison Shepherd. I am the lead clinician at Daybreak Treatment Center. I have been there for 4 years now. And so for those of you who don't know about Daybreak, we are a partial hospitalization program for adolescents. And so partial hospitalization, looking at levels of care, we are a step down from inpatient. So we get a lot of referrals from kids who have been either in residential or Lakeside, Parkwood, places like that. So they've usually completed inpatient care and then they come to us, or outpatients will refer up to us. So kids who are needing a higher level of care. So we treat adolescents. We take kids 10 to 18. Mostly we treat a lot of depression, anxiety, ADHD, behavioral issues. We also have a family component. We work with the families of our patients and we provide a parent group once a week. So our families have support. Let me see. Our census right now is 18 kids, and that is because of COVID. We are in person. So in order to accommodate social distancing and just the size of our facility, we can only have up to 18 patients right now. Pre-COVID, it was 28 that we would be able to treat at a time. So a bit less, and that's okay. I am looking through Tristan's questions over here so I can answer those. We don't require assessment experience at our site. We do administer the MMPI and the Woodcock-Johnson upon admission for all of our patients, and this is just done by staff. Yes, we are in person right now. Our interns, we have 2 this semester. They are coming in person. We've had to go virtual a few times. We have a COVID protocol that is, if someone is exposed or test positive, then we will go virtual for the 10-day period. And our interns have been able to still participate in groups when we were virtual. So they have still been able to get hours that way. We are not a trauma-focused site, so I should have started with this, but we are a DBT certified facility. So we do dialectical behavior therapy. That's the treatment we provide. So we do that as an individual treatment, and then we also provide a DBT skills group. And so when using DBT, trauma is usually focused on after they are stabilized. And so that's the focus of what we do, is help with stabilization. Our kids are in program for 7 weeks. So it's a 35-day program. And it's a day program. So they come in at 8 and then parents pick them up at 2. Let me look at these questions. Program hours are from 8 to 2. And we generally require all of our interns we are looking for part-time interns at least. Love to have you guys full-time as well. But we say at least a minimum of 20 hours a week. Most of the time we are going to take internship students over practicum students. And that is just because we want you guys to have some experience before coming into the facility. We are treating a lot of very severe, intense patients. And so it's usually helpful for you'll learn more if you've had some practicum experience first. And then, yes, you'll get a lot of opportunities to, you start off co-leading groups with our therapist and then moving up to leading. There is not as much individual time at Daybreak, and this is something Dr. Cogdill is aware of. And so we work with y'all to make sure you get your individual hours, and it's mostly group centered that we provide. But for individual, there's opportunities to observe assessments, individual sessions, and then as you become more comfortable, there are coaching opportunities to work one-on-one with the kids on skills. We usually assign our interns to a therapist, and then they'll work with their assigned patients. So, and we do not take undergrad interns, just master's level. So yeah, I think that's most of it. Tristan, is there anything else that I need to cover?
I think you covered it all. So I want to also say that I've interned at Daybreak and now I'm a DBT group leader. And so Daybreak is definitely a great internship site. You learn a lot. If you like DBT, Daybreak is the place to go. So thank you so much, Madison.
Thank you, Tristan.
Okay, so now we have Church Health Center. Do we have Church Health Center here? Okay, we will come back to Church Health if they show up. Okay, so we're gonna move on to Rhodes College Counseling Center.
Hello, everybody. My name is Haley Alsafar. I'm one of the assistant directors here at the Counseling Center at Rhodes. It's really nice to see people's faces. I feel like I haven't seen folks in a while, and some of you, I've talked to you and not seen your faces. So even though it's just your face, I appreciate it. Anyway, so a little bit about Rhodes College Counseling Center, our site. We just to share about my experience, I was actually an intern here when I was at U of M for my master's in counseling. So I really enjoyed the site, obviously, because I've found my way back here. So one of the things that I found kind of surprising to me as an intern was the just kind of the wide spectrum of presenting issues that come through our door. We do have quite a range of folks coming in with just a variety of things. So you do get a good experience in terms of just clinical presentation. We do have some, we market ourselves as, you know, a short-term counseling center, but we do get folks that come in crisis. We do have to engage in hospitalizations at times or referring to higher levels of care. So we do have quite a range. We are functioning and open from 8:30 to 5 Monday through Friday, and we close for the lunch hour. So typical day for an intern or practicum student looks like we're very heavy with individual counseling. We do group therapy as well, and we do support groups also, but we do have a very heavy individual counseling load that you can look forward to if you're here. COVID has hit us kind of hard. So we've had folks that are coming in that are having, you know, a little bit of difficulty getting as many hours as they would like. This semester, it seems to be picking up quite a bit because students are back on campus. Some students are back on campus. So we have seen the caseloads pick up already, and we've just started back, I think last week. So, or the week before maybe. So anyways, lots of individual therapy. One of the pieces of feedback that we often get from our interns is that we do a really good job with supervision and support. One of the things that I value just working here is that all of our counselors, all of our clinicians have different things that they're bringing to our team. And so we have, you will be assigned to an individual supervisor, and then you will also have group supervision every week with your cohort. So we recruit from different masters and doc programs. So you'll have kind of a variety of folks coming into the cohort, which provides a rich supervision experience. And then yes, our staff as well provides, you know, at each group supervision, we'll sometimes have little cameos where people will come in and talk about, you know, their different approaches and things. Last week, we did, our group soup was on IFS and EMDR. And so you get to hear a little bit about different people's approaches and things, which is pretty valuable to interns. They tend to like that. And I enjoyed it, of course. Let's see what else. Oh, so ideally, kind of the way that we bring on interns is we prefer to have, you know, a 20-hour internship or prac experience is kind of good for us. And we like to have somebody that will stay on for fall and spring. So if you are splitting your internship, we want you. We love that. So because we really like to, we give a lot to our interns. So we like to kind of have you to stick around and put all of the stuff that we're providing into your practice the second semester. We really enjoy seeing that growth. So that's something to share. Because we do have a variety of programs that we recruit from for our prac and interns, we try to keep a deadline of anybody who's interested. We want to have all of your interest inquiries submitted by November 1st, if possible. Now, that's not to say if it's after November 1st, you should not contact us. If you have interest, please contact us because, you know, we try to, things may come up, people may change, you know, their site, or we may end up needing an extra hand. So that's not to say you shouldn't contact us if you haven't before November 1st. Actually, the reason I was an intern here is because one of the staff members ended up having to go out on maternity leave. So I ended up being able to come to Rhodes to help out because she was out for that time. So what else can I share with you? I'm looking at the questions here. Yeah, we are completely virtual right now. We do see people in person as needed. Like if it's a crisis assessment, usually, you know, if we're looking at hospitalization, we'll bring them into the building. But we also have a psychiatrist on staff that we contract with, and she sees folks on Fridays. She sees our students on Fridays. So you will collaborate with her if you have a client that is seeing her as well. Let me see. I'm trying to think if there's any other questions that would be good. So yeah, I think that's kind of the basics. Tristan, is there anything specific else that you would want to know about, or?
I think you did a good job covering what services you provide and an overview. And if anyone has questions, we can ask more at the end. That's good. All right. Awesome. Thank you, Haley.
Sure. And just so y'all know, I may pop out if there aren't any questions for me up front at the Q&A. I do need to scoot. So if you do have questions, Tristan, you have my email, so feel free to reach out to Tristan to get into contact with me. I welcome any questions or anything that you all have to ask or want to know more about. Thank you.
Thanks, Haley. Sorry, I muted myself by accident. We have Christ Community next. Christ Community here.
Sorry about that. It's me. Can you hear me okay?
Yes.
Yeah, it looks like my video is not on. Sorry, I may have left my telehealth video on, guys. I apologize. I've not got it together today. I was getting it turned off. It's the danger of working from home, right? So as I'm working to get this video going back, I'm Dr. Tara Samples. I'm the clinical training director at Christ Community, and I did leave my telehealth video on. Let's see if that works now. Can you see me? Hey, sorry about that. I'm the clinical training director at Christ Community Health and clearly working from home today. Let me tell you a little bit about what we offer at Christ Community. So Christ Community is the largest primary care clinic in Memphis. We care for about 15% of the population of Memphis for their primary care, pediatric care, OBGYN, and dental needs. And we work a model called behavioral health consultation, which means that we do same day warm handoffs for people who have come into the primary care clinic or the dental clinic or the pharmacy who've been identified as having some kind of behavioral health need, which might mean mental illness, it may mean stress, it may be substance abuse, it may be a developmental concern. Child behavior concerns or ADHD or adult dementia, grief, loss, those kinds of things. And then at times we may just see a patient for that same day event, or sometimes we may follow them for a short period of time for a brief intervention. We also do health behavior consultation. So we work with our doctors for patients who have chronic illness, HIV, diabetes, hypertension, cancer concerns, medication adherence, to provide behavioral health support for those things. We currently have 7 clinics in the city of Memphis. I work at the 3rd Street Clinic when I'm in the clinic. And we also have a telehealth support program to our Jackson, Tennessee office, which is in Central Tennessee. We offer a variety of experiences: substance abuse, child behavior, adult grief, medical interventions. But all of our behavioral health providers are generalists, as well as having some special experiences in that. So students who are interested in a particular area can certainly put in a request for that, and we can try to match you to a behavioral health provider who has that interest. Now, let's talk a little bit about what it looks like in COVID. So like many of the people who've presented before me, Christ Community sent our behavioral health staff home in March. Because behavioral health appointments, while ours are short, usually 30 minutes or less per appointment, they're still longer than is recommended for COVID spread. And so for that reason, for the last 9 months, we've been seeing patients by telephone and televideo. Some of our patients are seeing us from homeless shelters on the, within the clinic, because about 30 to 40% of our patients are completely uninsured. We are slowly moving our behavioral health staff back into the clinics. This fall, I had 2 practicum students, and right now I have 2 practicum students. Generally, we try to take 3 master's level students, 2 doctoral level practicum students, and then starting in August, we have a doctoral level internship. So we also have 2 clinical psychology doctoral students, and we usually also have licensed clinical social work students, all at the same time. We have really reduced the number of students we're taking right now. And we're not taking any master's level students for internships. I just cannot make sure that you'll get the hours that you need at the current level of reduced clinic time. We are taking practicum students, and I do have openings for this summer if there are students who are still looking for positions for the summer. But I will probably limit our practicum students to just 2 or 3 students. So I'm going to be looking for students who really have a lot of passion to do primary care work, which is a really specialized field of interest, and for students who are really interested in working with the community that we serve. This isn't the kind of experience that you want to do unless you specifically are interested in working with poverty and high trauma and with behavioral health needs, because it's a very specialized field of care. We have a really excellent behavioral health team who's on our training committee. So students who place with us will have an opportunity to attend a weekly didactic training, which is a combination of our social work, clinical psych doctoral students, and our master's students, and it happens on Wednesday afternoons. And so we cover all kinds of topics, everything from like perinatal and postpartum depression to assessing for diabetes needs or HIV care, diversity concerns, ADHD. We have various topics each week to learn about in primary care, what that assessment looks like. Students who are in the fall will attend, will possibly be assigned a doctoral student to supervise them, but they'll also get one-on-one time with a graduate or with a licensed provider. And then we'll also have group supervision together. So to be a practicum student at Christ Community, you need to do probably close to 12 hours a week in order to make sure that you're meeting your hours. So that's really a day and a half of commitment to the clinic. Occasionally I will have students who really want to do evening hours. And I do have clinics with evening hours, but I do not have clinics that are sufficient in evening hours. So what that means is that you can maybe work a full day. You could start at 8 in the morning, go all the way till 8 p.m. because we have clinics that are open for 12-hour shifts. Or you could do like a partial day the day before and then work a 12 to 8 one day. But you cannot do only evening shift. And I wish we could accommodate that, but we really do want you to have a single supervisor who you answer to, and no supervisor works more than one evening a week. So you would be assigned to a specific supervisor and only work those evening shifts that they are working. The other question I get from students a lot is, what does it mean that Christ Community is a faith-based organization? So Christ Community was founded by a group of Christian doctors in the mid-90s, intentionally choosing to serve out of their love for Christ in communities that were not well served, that didn't have other medical providers there, and didn't have access to services. That continues to be a really important part of our mission. All of our full-time staff identify themselves as Christians and identify working at Christ Community as an act of service, but we do not expect that all of our graduate students would be Christians. We only ask that graduate students are respectful, that you will hear conversations about faith with patients. One of the things our patients are offered in service at Christ Community is that our providers will pray with them if they're interested in that, or we'll talk about how faith might be engaged in their medication or in their beliefs about their illness. And so those are conversations that we have. And so we ask that students are just open to be aware that that may happen. And our job isn't to proselytize students or to expect students to pray with our patients if they're not interested. But for students who are interested in faith-based interventions, we talk a lot about what ethical intervention looks like. How do we engage faith with respect to diversity, with respect to differences in faith? Because a lot of counselors, psychologists, social workers leave graduate school and hang out shingles and call themselves faith-based providers, but have never really done the work around what does that mean to think about it ethically. And so that's a really important part of the training at Christ Community. If you're going to apply to us, you can email me directly with questions. My email is just tara.samples@christchs.org. Or you can go to the Christ Community website, and there is a student behavioral health link, and you apply to the practicum through that, and it will ask for your resume, and want to put in a cover letter just telling me when you're interested in training. I usually like applications about 3 months before the start of the particular semester that you're looking for. I will tell you that I start getting applications for the summer usually at the end of the spring. I'm sorry, for the fall at the end of the spring. So the fall is more competitive than that summer position is often because more students are looking for that placement. And I interview until I fill the positions. And so early birds get the worm. We really encourage students who are interested in working with ethnic minority populations, particularly students who are ethnic minorities, and students who speak Spanish to apply. We have one clinic that is about 80% of our patients there speak Spanish. And our Broad Street clinic also works with International Rescue Mission and works with a couple of refugee settlement communities in Memphis. And while we've not been working with a lot of refugees in the last few years, our understanding from a meeting we had a couple of weeks ago is we're expecting new refugees to start arriving in Memphis very soon. And so our Broad Street clinic provides all the initial medical assessments for new refugees in Memphis. And that is a really good experience for graduate students who want to provide mental health care for people who are adjusting to moving. So I'd love to answer. I'll be around for a little while when we split up for questions, but if I miss you, feel free to email me directly, okay? Thanks.
Thank you so much, Tara. That was a lot of great information. I learned stuff myself, so that's awesome. Okay, awesome. Next, we have Health Connect America.
So good evening. My name is Ariane, and I want to start off. I'm a graduate of the program, so it has a special place in my heart. And I actually got to Health Connect through my internship in my program. So I know what it looks like to intern, especially with my company. I'm currently the director for our Memphis office of Health Connect. We're across the entire state, and we are in 4 other states also. Currently, as with everyone else, I have had to limit my number of interns. Normally, I can do 2 to 4 interns a semester, but right now I can just handle 1. I'm still accepting interns for the summer and fall, but I'll probably just have 1 slot. And I do have multiple schools that do hit me up. But as other people said, it is kind of for me, first come, first serve. So whoever email me first, I do set up interviews and we talk through to see if we're able to give you the placement that you're looking for. We accept interns and prac students of all places. So we'll take bachelor's, master's, and doc students. Interns with us get a combination of things. So you'll be able to be involved in group work. We have intensive outpatient groups that are meeting. We do individual counseling and we do community-based counseling. Of course, right now due to COVID, majority of our services are telehealth. So interns are still able to see clients. Our our population ranges from the age of about 6 to 66. The average age range is though between 9 and 15, and we have clients refer to us for every issue. Someone could need counseling. It could be for defiance, it could be for psychosis, suicidal ideation, trauma, communication issues, relationship issues, whatever is an issue, we most definitely are addressing it within our services. And we are working from a trauma-informed lens. All of our staff are trained in TFCBT. We do give the opportunity for our interns to get trained too in TFCBT if they're interested in that particular intervention to address trauma. Students will get their hours, but to ensure that students are, again, I had to just limit the number of interns I can take, just given that, like everyone else, we don't have as many referrals as we had prior to the pandemic. Make sure I'm answering all the questions. I think I hit a lot of it in a nutshell. We do mainly focus from an idea of CBT. We do use some motivational interviewing, but we do encourage our interns, as we do with our staff, to be creative, given that most of our clients are kids. Traditional CBT you might do with an adult will look different than a 6-year-old as opposed to a 16-year-old. So our interns, as with our staff, can be creative when they're working with clients, and we're here to assist them with that. So as I said, interns get a little bit of exposure of everything from individual to family therapy to group therapy. And as I said, I was an intern, so I got here, graduate of the program, and I highly value being able to continue offering positions for students from the University of Memphis, especially the counseling department. And I know we do have one who just started with us, so we're really excited to continue assisting. And I do hate that we had to limit our number, but again, I want to ensure that interns are getting the best they can, the best experience they possibly can. Is there anything I didn't cover?
I think you covered a lot.
Okay, awesome.
Thank you. And we love to see our former graduates. So thanks for coming. Okay, awesome. So now we have the U of M Counseling Center, Dr. Liu.
Hi, everyone. I'm Dr. Lin Liu. I'm the training director at the University of Memphis Counseling Center, or Student Health and Counseling Services. We at Wild Oak Tower, or when we were in office, we at Wild Oak Tower. And we have a pretty big training program. We have a big practicum training program. So for intent and purposes of our training program, when you apply for the master's level, when you apply for internship and practicum, we call it all practicum. So when you navigate our website, you will see that the internship program that is on our website is APA accredited doctoral internship program in health service psychology, and that's a different thing. So we have interdisciplinary staff, social worker, clinical mental health counselor. Many of our counselors graduated from the University of Memphis. We also have licensed psychologists. We have pre-doctoral psychology interns who who are full-time staff, and we have 4 of them every year through the APA match process. In terms of the practicum training program and practicum and internship at the master's and doctoral level, we typically, before COVID, we typically have up to 8 students. Unfortunately, because of COVID, so very similarly to a lot of other sites, we limit the amount of students to make sure that the students can get, all the experiences, and also making sure the students get the supervision that, and we can dedicate all of our efforts and time for students. And so this year we only have 4 students. We do prefer to have folks to spend both fall and spring. However, we do take students from the master's program are doing practicum with us for 1 semester. A lot of the times, students end up coming back to the program for their internship year. Our staff really operate from developmental model. We meet trainees where they are at. We provide a lot of good supervision. Trainees receive an hour and a half of individual supervision and also 2 hours of group supervision. College students, but as you may be already aware, our university is very diverse and also have a lot of non-traditional age students. And so it really reflective in our clientele. We see students really range from 18 to 60, sometimes older than 60s, and clients really bring in a lot of diverse clinical issues. The whole DSM, we really do see a diverse clinical presentation there, and we have a very good, robust triage system to make sure that we assign client cases for trainees accordingly to your developmental model and developmental stage. Our staff operate from very diverse clinical theoretical orientation, CBT, interpersonal process, psychodynamic, you name it. And our practicum students and interns get to do a lot of individual therapy, lots of outreach. And before COVID, we also allow practicum students to participate in group. Unfortunately, during COVID, we limit the amount of group therapy at our center. So the experience is not guaranteed, but hopefully when we're back in the office, our group program will be back to normal. And also during COVID, we unfortunately have to temporarily suspended our behavioral health consultation program as the counseling center and the health center, we are one integrated center. And so before COVID, we do have our trainees pairing with our staff to be at the health center to provide behavioral health consultation for the clients or to the patients who seek health services at the health center. Unfortunately, we have to put a stop to that temporarily because it's not safe for students to go and see patients at the health center at the moment. During COVID, we have been providing, all of our services have been telehealth. However, we also are very aware of the fact that not all trainees have access to, a private space to provide therapy, confidential therapy, or also sometimes people don't have stable internet. And so we offer for all of our practicum students to come in the office, of course, social distancing, but they can provide therapy. They can provide telehealth from the office at Wilder Tower, while some of our staff will be there to, provide supervision. We open 5 days a week from 8 o'clock to 4:30. And some days we open until 7 during the semester. We don't particularly have requirements for how many hours the students have to be on site. We really try to work to meet the trainees' needs and knowing that, some students coming in with some hours already, and some students really need more hours to make up for their previous placement that didn't, that they didn't accrue enough hours. And so we typically have individualized plan with trainees to make sure that they meet the requirements of your training program. And we do not have summer internship and practicum, unfortunately, because we typically don't have a lot of new clients coming over in the summer, and so just not really good for trainees to be there because you're not going to get a lot of hours. And then what else? I'm looking through the questions here. We used to have, like a undergrad internship program for bachelor's level folks. Unfortunately, during COVID, we don't have it. Hopefully by fall semester, fingers crossed, things will be back to somewhat more normal, then we can resume that program. I think that's it. And we do provide a lot of didactic training for our students, ranging really various topics from different theoretical orientation, as well as the work with different populations and different types of traumas. And we do see quite a bit of trauma at the center, but we make sure to assign cases appropriately with the students' level.
Thank you so much, Dr. Liu. And you made a really good point about how you see a wide range of issues. I know at the Rhodes College Counseling Center is probably the same, and they see more than just like what you would academic difficulty. It's like a wide variety of things. So yes, that's a very good point. Thank you. Okay, we have Latasha with Knowledge Quest, and I got your email for a PowerPoint. So let me open this really quickly.
Okay, well, I'll just give like an overview of Knowledge Quest first, and then that PowerPoint is specifically around our UP Center. So Knowledge Quest was founded in 1998. Our executive director is Mr. Marlon Foster. And so under the Knowledge Quest umbrella is like home, health, and opportunities for youth. So under our home umbrella, we have Universal Parenting Place, and then we have our Family Stability Initiative, which offers case management services. And then on our health initiative, we have an urban farm, as well as cooking classes. And then opportunities for youth, we have a virtual after school program. And on last semester, we had a day program for the students. So I want to go back to under the home opportunity, which our Universal Parenting Place falls up under. And so the UP Center was founded in 2015. There were 2 sites, the Knowledge Quest site, as well as the Baptist Women's Hospital site. And so you can go ahead and, if the PowerPoint is ready, go ahead and share it. Okay, so we were pilot sites funded through the ACE Awareness Foundation. And so again, the centers were founded upon trying to reduce ACEs. I'm sure all of you all have heard of ACEs, maybe some presentations, but dealing with those adverse childhood experiences. And so the thought was to be prevention based. Let's uncover some things. It's okay to talk to a therapist, if you will. The Knowledge Quest site is based in South Memphis. So 38126 zip code 106. So we are community based. Okay, so back in 2014, this particular site mentions about the ACE survey. And of course, the higher the ACE scores, the more likely it is to, toxic stress and, have a lot of negative impacts, if you will, on individuals. So the need for our community is definitely there. So what we're wanting to do, you can go to the next one. It's okay. I'm just going to roll with you. So the need is definitely there, and to reduce ACEs in our children. Of course, the flagship program for Knowledge Quest is our after school program, and so in the families that we serve. So we have 3 sites along Walker Avenue, and so yes, we are targeting 38126 and 106, but the UP centers can anywhere can come to the UP Center. So it just doesn't have to be this particular community. Again, it is non-fee based. You cannot be mandated to come, but you are invited and welcomed. It's okay to talk to someone. And so that's where the UP Centers came about. Just wanted a warm and welcome environment. Hate that we can't meet in person right now during COVID, because we have a really pretty cool space here. As always think about it as a cross between the Children's Museum and Starbucks. So, have a play area for the children to come while their parents come in for sessions, or even having counselors be able to do one-on-one sessions with children that are part of our after school programming. Okay, so the next slide. So the UPS can help with, again, from small issues to large issues. Again, it's prevention based. Now, if there's some, of course, no medicine or anything like that, we do referrals if there are things that are beyond our scope. So, if there's some parenting challenges, because of course, there's no handbook on parents, and there's some, hey, you kind of trial and error, if you will, and best practices and strategies. So we're wanting to walk alongside parents, if you will. So individual groups, family counseling, support groups, therapeutic groups. We have a partnership with Playback Memphis, so doing some improvisational theater. We look at these as alternative therapies. And so even with exercise, yoga, nutrition, all of those kinds of things, trying to decrease stress, promote resilience, and really just helping our families. Okay. Yes, I kind of mentioned those things that are offered through the UP centers. So why does it work? Again, just being transparent. Oftentimes in this particular zip code area, counseling is not as common, if you will, as in some other communities. So encouraging parents, to talk to someone that is, stress is real, and affects our blood pressure, how our moods and all those kinds of things, and that you are not alone, that you can walk, that there's individuals that are here, you know, that are trained with special skill sets that can help you. So we're excited that we've had interns. We have interns right now that are part of U of M program that have been able to get hours through the UP Center here at Knowledge Quest. And so I think I see a couple names I saw on the list earlier. So we're excited about them being able to do counseling with our parents, be able to do some groups. We actually have a group on this Saturday. We have 2 interns that will be facilitating that particular group with a group of parents. We had during December, there was a grief support group, and their interns kind of collaborated to lead that group during that month of December. Okay, is that the last slide there? Just like we always say, like you go for checkups, go for health checkups, or get your car checked up, mental health checkups, you know. So again, in our particular community is trying to get our families to take advantage of counseling, that it is okay. And then oftentimes word of mouth has been very powerful in getting parents to take advantage of the services. You know, parenting oftentimes didn't come, you know, it's challenging for all parents. So it is okay to talk to someone. So we can tell people that they can just call the number to make an appointment, or go on our website and request an appointment, and then a counselor will be calling. So yeah, I hope I kind of covered everything in there, but just so excited for the partnership with University of Memphis. And so we love interns, and we definitely need the interns. And so yeah, that's UP Center here at Knowledge Quest.
Awesome. That was great. Thank you so much, Latasha. I know we have a lot of interns there, and y'all have really been helpful recently. So thank you. Alrighty. Okay, so next we have, let me get out of this. Youth Villages. Is Youth Village? Yes, Abigail. Hello.
Hey, I'll introduce myself real fast, and then I'm going to turn it over to Casey. My name is Abigail Vanderlaan. I am a recruiting manager with Youth Villages, and previously worked, actually started as an undergrad intern, social work intern, and then have worked in our residential program for a couple years, and now work in recruiting and help with the summer internship program as well. But I'm going to turn it over to Casey, who has also worked in our community-based programs, and she'll share more about that. But I'll stay on later if there are any questions.
Hello, everybody. So I am Casey Falk. I'm with Youth Villages, a recruiting department. Let me see. I thought I had my video up. Let me see. Hold on one second. There we go. Okay, should have come up by now. So I was going to talk to y'all about our internships in Youth Villages as a whole. So of course, with Youth Villages, our mission is that Youth Villages helps children and families live successfully. Now we do have a couple of internships. We have our summer internship and our fall internship. The summer internship is a paid internship for both bachelor's and master's level.
I think you muted yourself.
There we go. So sorry about that. Our summer internship is both for bachelor's level and master's level, and our fall internship is for master's level. The summer internship is a paid internship, and our fall internship is for course credit. With the summer internship, you'd be working on our residential campuses. You'd be working with our kids there that range in age between 8 to 18 years old. And then with the fall internship, you could be working with either our residential, our kids on residential campus, or our community-based programs. With the, excuse me, just a second.
I can jump in here real fast. Well, Casey will be back here in just a second. So we do take quite a few interns within our programs throughout the year. As Casey's mentioning, we have quite a few different programs really based around providing behavioral and mental health treatment for youth and for families. And so we do have our community-based programs, such as our Intercept program, where we're really going in-home to prevent out-of-home placement and also assist with that transition when youth have been in an out-of-home placement and transitioning back. And so we have moved to a lot of telehealth with that program. And then we also do have our foster care program as well that typically takes interns in the fall, master's level interns. But then, as Casey was mentioning, our residential programs, we have bachelor's level opportunities working with our direct care staff and leadership team, and we'll get some interaction with some of the clinical staff, but our master's level interns do get to work alongside our master's level counselors on our campuses and assist with facilitating group therapy, individual therapy, and some family therapy as well. So I'll turn it back over to Casey here.
So sorry about that. Life of having a 2-year-old who wants to see his mom. Sorry about that. So like Abigail was saying, we are working with our kids, our residential programs, providing both individual, family, and group therapy. We do use evidence-based practices for all of our treatment. And for our community-based programs, we are working towards reunification or diversion. So if any of those kids have been removed from the home to go to a residential treatment setting or even a foster care setting, we're going to work with their biological family to make sure that they are, that transition back home is as successful as possible. So the hours for these programs are both going to be pretty much Monday through Friday. The hours can vary with those. You're going to have a caseload, probably 2 or 3 cases that you would see through the week. Our community-based programs, you'll do multiple sessions through the week, along with having a meeting called consultation, where you'll meet with your team, your clinical supervisor, and a licensed consultant to review your treatment plans and go over treatment direction as well. So we're really making sure that you have that supervision and you have that team feeling as well, while also learning all those evidence-based practices and making sure that we're providing the best care for our kids.
I think the only thing that I add for that as far as timeline goes, we are currently accepting applications for summer interns. The deadline for that is March 1st. So again, that is a paid opportunity for both bachelor's and master's level. And it also can be used for course credit as well, where I know we've worked with University of Memphis before and had quite a few different interns in the past, and so can accommodate. With the hours, it is during the day. So we don't have evening hours available for internship or practicum. So I do want to be upfront about that. But I would recommend applying sooner rather than later. We are going to have a more limited program. Typically, we have usually about 15 master's level interns, and this year it'll be more around 7 or 8. And then usually we have 40 or so bachelor's level, and so we're going to cut that in half or a little bit less just due to COVID precautions, but it would be in person. And then for our fall interns, we'll start accepting applications for that in about May, and we usually take about 5 interns or so, and that just depends on our supervision availability, but it's usually about 5 interns for the fall.
Thank you so much, Abigail. Yes, I know some students ask about paid internships, and I know that Youth Villages Summer is probably the only one that I am aware of. I might be wrong, but definitely one to keep in mind. So thank you so much. Okay, so we have the Brain Center and Lebaner, Dr. Schaus next.
Hello. So I'm really excited to talk to you all about this new partnership. So essentially, last fall, I received a grant from the Urban Child Institute for a new initiative to start a mental health counseling division within the trauma center at Lebaner Hospital. So prior to this initiative, no mental health counseling services had been offered to any children or family member who had been treated at the within the trauma center facility at the hospital. So one of my colleagues, who is the chief of trauma surgery at Le Bonheur Hospital, had mentioned how, you know, she as a surgeon noticed that while she's healing the physical wounds of trauma, there were so many emotional scars that came alongside of it. So this initiative was something that she and I had been talking about seeking funding for the last close to 3 years. So we've been trying to kind of get this partnership off the ground for quite some time. And the COVID pandemic really gave us a lot of data in the sense that just with the enormous rise of community violence and juvenile homicides, her emergency room has just been flooded with pediatric gunshot victims. And we had a local funder that was really interested in supporting this initiative and getting mental health counseling services to the children and the families that were being seen at the center. So essentially, basically this whole project started the beginning of January, so this January. So we are in the midst of rolling all of this out right now. We have our first group of interns this semester. So we have 7 interns. They just started, and I will tell you that the onboarding process is a lot of information. It's a lot of training, both on the hospital side. So about 40 hours of training on the hospital side. They do treat you like a hospital employee. So you have to complete a lot of compliance. You have to do a lot of their medical records trainings, background trainings, human resources trainings. You do need a background check. You need vaccination records. You need flu shots and documentation of a lot of your own. So, you know, it's quite extensive in terms of the amount of information that you need to provide on the front end to get you cleared to be able to work in the hospital. But they do, you get a badge, you know, get a parking sticker, and you are considered essentially an employee of the hospital, even though you're working as an intern. There are no mental health counselors. We are the first group there. So in a sense, it's exciting because we're pioneers. So my hope is to get mental health counselors infused throughout the hospital. Not just in the training, not just in the trauma center. So essentially we are in the inpatient unit, and inpatient meaning inpatient trauma. So anybody who comes through the emergency department or who gets admitted through trauma will be a patient of ours. And then what happens is they'll discharge to the outpatient center where we see them as well. One of the great perks or benefits of this grant is that there's no limitation in terms of the amount of services we can provide. So essentially we're providing ongoing counseling services to children and families without any cap or limit in terms of, you know, 6 sessions, 10 sessions, 12 sessions. There's unlimited amounts of sessions that are available to them should they want it. I use a model that's a hospital-based model called IPSRT. So you would need to complete that along with some mindfulness training and some active parenting training as well. So there's quite a lot of training on the front end as part of the internship, but with that comes certifications in that you guys would be certified in these methodologies that you would be able to, you know, take with you and apply in any of your future practice. So let's see, it is a predominantly day focused internship. So weekends are not available. Early mornings are available. And the reason why I'm saying that is because trauma team typically rounds very early. So students who need to get extra hours or who want to get extra hours, who want to round with the physicians, that starts at 6:30 in the morning. You don't have to go at that time, but some of our students like to do that. They're early risers. They really like working in integrated behavioral health. They like it's fast paced. It's very intense. You're running around all day long. So you're very busy. It's, I guess, non-traditional in a lot of sense that, you know, you're very, you know, your day looks very different day to day. But you are part of an integrated behavioral healthcare division. So you're working in partnership with medical doctors, nurse practitioners, nurses, social workers, physical therapists, occupational therapists, and just in a medical setting. And let's see what else is there to know. We are in the process of updating our website. So the braincentermemphis.org. I will have probably within the next few weeks the link to apply for internship. It is just an internship site. It's not a practicum site. But right now, like I said, we have 7 students. We can take probably between 7 and 10 students per semester. There's a lot of work to be done. It is an in-person setting, so there's no opportunity to kind of do telehealth, although we do provide telehealth, but we are at the hospital when providing telehealth, if that makes sense. So a lot of people who aren't able to come for follow-up services in person can get telehealth counseling services. However, they're provided at the hospital. So like I said, it is an in-person, so you would be expected to be on site. But I will say that the COVID precautions, I feel safer there than I feel pretty much anywhere else. They're very disciplined and regimented about their COVID screens and procedures. So it's just very well done. And let's see. So applying. So we will have a link on the Brain Center Memphis website that should probably go live sometime in the next couple weeks. But it'll be ready in mid-March if you guys want to look out for that to apply. And we'll probably have interviews in early April for those students who are interested in summer internship. So we will be offering summer internship and then again in fall. So we'll have it year round. So keep an eye out for that. And I'm trying to think of anything else, but I think those are the main points.
Yeah, I think you've probably covered it. You gave a lot of good information, and I know that we're all pretty excited about the new opportunities at the Brain Center. So thanks for sharing everything. Okay, so lastly, I think is Clarissa Everett from Restore Corps.
Hello, everyone. My name is Clarissa. I am currently a residential survivor care coordinator with Restore Corps, and I'm transitioning into a new position working with the Tennessee Department of Correction under the Restore Corps umbrella. So we serve human trafficking survivors here at Restore Corps, and our work is nonstop. So we work 365 days a year, 7 days a week. So if you need flexible hours, that's definitely a good thing to put out there. Now, as far as like overnight, we do have a safe house that is open all the time. However, we don't allow interns or practicum students to be there at the house during that time because it's sleep time. So if you need hours like evenings and weekends, those are available. As far as virtual versus in person, we do have interns in the past who have done therapy with individuals. I'm sorry, there's someone else's background talking. Okay. We do have the opportunity for you to do virtual or in person. It just depends on, your needs and the client's needs. so to speak. So if you want to like provide individual therapy to our clients and they need to meet virtually, you'll have that option versus or in person. It just depends on the case. Because we serve the human trafficking population, our days look different. No day looks the same. You never know what you're going to get depending on, your caseload. We practice in the trauma focused cognitive behavioral therapy lens with our counseling. However, there's some motivational interviewing, some DBT, all of that intertwined in the care that we provide to our survivors. As far as groups, we recently launched our intensive outpatient program within Restore Core. So it's our own intensive outpatient program that we launched. We had to switch to IOP on the go is what we named it here recently, where we're doing it virtually. However, we're looking at partnering with Life Church to provide those services in person, hopefully in March. We just need a bigger space to do it so we can actually social distance like we're supposed to. And let's see if I can pull up the questions. Yeah, I think that's as far as like the opportunity to work within the prison system, because my position is very new. I literally started on the 1st of February. The first 6 months of my position will be developing the program that will be implemented in the prison. So I won't be working directly with individuals in the prison just yet, but come like August, September is when I'll be going into the prison and actually performing groups and working with individuals within the prison system. So I think I pretty much touched on everything. If I missed anything, I am putting my email in the chat right now, and feel free to reach out to myself or our care manager. Thank y'all so much for having me.
Thank you so much, Clarissa. All right, so I think that's everyone unless Church Health managed to make it. Okay, I'm guessing not. Okay, so that was everyone. So thank you so much for presenting. I learned a lot of information. I'm sure that students here have learned a lot too. But we want to give this time and we want to open it up for questions from students to sites. And so if you have a question, you can put it in the chat box. You can pop on. If it's a general question, just let us know if it's a general or if it's for a site. If you have a question about the Transformation Center or Daybreak Treatment Center, I can try to answer those to the best of my ability. But yeah, does anyone have any questions?
I do. I have a question. I was about to type it, and I'm just like, wait a minute, we're here on the call. Why not talk? So first, I want to say thank you to all the wonderful presenters. I feel like I just learned so much about all of the services that are available in Memphis. My question is for Dr. Schaus about the Brain Center. I know that you said that the work is new and you all are looking at developing what the work is going to look like. I am in the rehab counseling program. So I and several other rehab students need rehab specific practicum and internship experiences. So I was wondering if you all were looking at providing any rehabilitation services for the children or their families and what that might look like. And I guess that also applies to anybody else who might be providing rehab services.
Sure. So essentially, a majority of the children that we're working with have TBIs. In fact, I saw multiple today that had been in car accidents over the past weekend. I don't know whether it be because of the Super Bowl or what have you, but we had 6 children that were involved in pretty severe car accidents that all had TBIs. That's just to say that that's a very common occurrence that's that we're seeing, which really falls under the, you know, the spectrum of rehabilitation counseling. So, you know, that is, that's something that is most definitely falling within that realm. The supervisor on site is an LPC and about to get her full MHSP. So I don't know, and I guess that would probably be a Dr. Cogdill question as far as for rehab students, does there need to be a CRC at the site? Because there is not, but the site does have rehab clients. So I'm guessing I'm going to leave that up to Dr. Cogdill to answer that question.
So typically we do have a CRC teaching the class, and that covers that aspect. Yeah. And rehabilitation counseling students have traditionally used clinical mental health and clinical rehab sites too, as long as there is a rehabilitation component to it. And that's a great example.
Mm-hmm.
Yeah.
So yes, we're open to rehab students. Absolutely. Please apply.
Melody, did you have any other questions? I know, or is that it?
Yes, but it really, my main question, thank you, was just surrounding like which sites on here provide, but I think Dr. Cogdill, I guess, just answered it about rehabilitation. Basically what I was just asking Dr. Schaus if which sites would be able to count toward rehab for a rehab student that needed rehab specific experiences. I feel like I said rehab like 6 times. I guess I need a rehab practicum and internship experience. But if anybody would, yeah,
one
go
of
ahead.
the other things, Melody, is, and this is where you need to talk to your advisor or Dr. West, is if someone is on the rehabilitation scholarship,
yeah,
and then it's more important to make sure that you can tie it to rehabilitation. And but what Dr. Schaus, you know, shared is a really good example. I don't think one of our sites that a lot of students use is on today, but it's called Lowenstein House. And Lowenstein House, I mean, they have hired a number of our graduates, but they're definitely a rehab site.
Mm-hmm.
But that is something that if students they are on the scholarship, they need to talk to Dr. West or their advisor about what those restrictions are for the scholarship.
Got it. That helps a lot. Thank you, Dr. Cogdill. Thank you, Tristan.
I can't hear you. Maybe try muting and muting again. I'm not sure.
I will just speak up here for just a moment. My greatest challenge, my story is that I am an older student and I work full time. I'm nearing the end of my coursework. I was hoping dearly to do a practicum this past fall, but COVID hit and that put a stop to that. Dr. Schaus, I would love to work with you at Le Bonheur in an integrative system like that. Is just something I'm really passionate about. But again, my obstacles right now is I have to work full time. So I'm just reaching out to those who might, I know some of you did speak to that specifically in terms of evening and weekend possibilities. But if you could, if you do have something that, or a place that offers that, if you could share that either through the chat or through Kimberly, or Tristan, I'm sorry, I'm Tristan. I would greatly appreciate that because I really need a practicum in the fall because I hope to do my internship. My kids are teenagers and about to graduate, but summers are my best opportunity to do an internship so that I can really devote and put my time into that. So, so there's just a lot of barriers for me on my personal story here, but really looking for fall to do a practicum. If I can find those evening and weekend opportunities. Yeah. And I'm really open to any experience. All of it is very informative. I find that every class I take is just, there's always that element of, you know, something that I find is vital to me moving forward. So I'm, you know, I'm open to that. Everything is a learning opportunity. So throwing that out there. Thank you very much. Thank you for listening.
I know I can answer, I don't know if Daybreak or said, but Daybreak is primarily a daytime site during the day. I know the Transformation Center, when they were pre-COVID, they had night groups. However, they've changed their schedule some, and I'm not the best person to answer that right now because I'm not there right now. However, they do, like, they would be a good summer side, like if you were going to go there for the summer. So.
Hey, this is Dr. Samples at Christ Community. So we don't offer full-time evening, but I know when I was in graduate school, I definitely was working full-time. And I have placed a number of students over the years in intensive outpatient programs that are in evenings at hospitals. So I believe that both Parkwood and Crestwind have intensive outpatient evening programs. So those might be good places to look. And I know that Lakeside has just opened a new IOP, and that might be an option also. Like those are the kinds of things you can fit around full-time jobs.
Yeah, I'm just not sure on the prac. You know, that's the main thing right now is doing the practicum. And I had spoken with someone at Crestwind previously, and I'm just not sure they offer the practicum there, but I'll reach out and ask them.
Yeah, it changes from semester to semester. So I would say, you know, give it another try. But sometimes they only want interns and other times they will take prac. One of the things I just want to remind students is that you cannot do a full-time internship in the summer, but you can do a part-time internship in the summer. The summer session is only 10 weeks long. And so there's just no way to get the 600 hours into a 10-week session. But as Youth Village is on the call, I believe they were going to.
Yep, I'm here.
Yes, okay. So Youth Villages, what do you all have some opportunities for nights and weekends?
So for our internship, we would not have the flexibility for evenings for the summer. Is our residential clinical team works primarily from, or I'd say about until 6 o'clock. Our in-home programs in the fall sometimes have a little bit more flexibility, but it's not going to be primarily evenings. Most of it would be throughout the day, afternoons, early evenings, but it wouldn't be primarily evenings. I will say I don't know what the requirements for U of M summer are, but you're talking about fitting in the practicum hours throughout those 10 weeks. Our summer internship program is a set 10-week program, but we have had people in the past who we've been able to keep on for additional weeks to meet those hours. We just are only able to pay for the 10 weeks. So we'd be definitely open to having that conversation to see if that would be meet with what your program is looking for.
Right, and that doesn't meet our K-CREP, unfortunately. Yeah. Okay. So yeah, I hear you about the hours, but yeah, yes. we wouldn't be able to do a full time.
Totally understand. Yes.
Yeah.
Do we have any other student questions?
I have a question about the summer. So if you, I know it has to be
part-time. But if you go like 40 hours for the semester, would you be able to kind of lighten your load? Because like you, Miss Rose, I'm kind of in a similar situation. Instead of like working, 20 hours a week, could you do 40 hours a week in the summer and then make up the rest in the spring semester or the fall semester?
Currently, it's really hard to say right now because of the pandemic. And so KCREP has been, they have worked with us on certain things. In a regular semester, they do not let us carry hours over. And so you can't like load up on summer hours hoping to lighten up, the fall. And so it's just right now a semester to semester, see what happens and what stage we're at. The practicum students have been able to, if they had an overage of direct hours, the practicum students have been able to carry their direct hours over to internship. At this time, KCREP has not allowed that for interns. I just, I'm always in touch with them because things do change. It's been very fluid, but right now that's the latest I've heard, is that we can't with interns carry over. Anyway, that's all I know at this point.
Thank you.
Any other questions for sites? Okay. Well, if we don't have any other questions, thank you all again for coming and participating. If you have any like last minute questions for Dr. Cogdell or myself, you can feel free to hang back. Dr. Cogdell, did you have any last words you wanted to say?
Well, I just wanted to remind everybody, it was in one of the emails, but I know sometimes there's a lot of information in emails, but the application deadline has been moved to February 25th. And so there's still time to get practicum and internship applications in. Once you complete your form, please do not email them to me. I will be sending out an email link or an address for you to send applications to. There are so many students that are emailing me these days that things can get, I don't want to lose anything in the cracks. So, but yes, we extended the deadline. So there's a little bit more time for you to kind of like think about what you might want to do. And remember that you do not have to have a site finalized at the time you submit your application. I just need to know ideas of where you're thinking about, so then I can kind of touch base with sites to see how many openings they might have.
Okay, great. Thank you so much for taking your time out of your busy schedules. And this is such a great event that we do every single year, and we cannot say how thank you all we are enough. And we look forward to having our students work with you all. Thank you.
Thank you, everybody.
Thank you.
Thank you, all the sites.
Thanks.
Have a good night.
Okay.
Okay, now I've done the mic off. So is it just students now? Oh, I guess I'm still, I've gone through all of the links, Dr. Cogdell, that you've got listed for the practicum and internship stuff. I'm still, I don't know if I'm just missing something. I'm just still fuzzy on the process, but you just mentioned that we just have to send out that application so that we can clear up what direction we're moving in. So we should not reach out to sites.
Oh, no, you can reach out to sites. I was just trying to make it clear that you don't have to have a site decided on. A lot of students are freaking because they're thinking,